Welcome to my Lecto. Today we are going to discuss clinical case 1. Actually, I have made playlist on the clinical cases, so you can check it out in the playlist. So let's start. First of all, if there is a patient and that patient is 22-year old and gender is female. Okay. And that patient is presented to you with the severe sore throat. Okay. And after that, I do physical examination, and after that, I found three things. First thing is the inflamed throat. So first thing is the inflamed throat, and that is also actually called the pharyngitis. Pharyngitis. Okay. Next thing is the cervical lymphadenopathy. So next is the cervical lymphadenopathy. This is the second thing in the clinical examination. Third thing is the splenomegaly. Splenomegaly. So these are basically the three things that actually found in the clinical examination. Next thing, the test, monospore test. So if you see that the monospore test, which is also called the heterophil agglutinin test, and that test is positive. Okay, now then it's time to diagnose what actually disease the patient has. So I have to diagnose these things on the basis of these informations. So first is the infectious mononucleosis, and second is the viral and different bacterial infection. Okay. First thing is the pharyngitis. You can see pharyngitis in both infectious mononucleosis and the viral and different viral and bacterial infection. So first thing is the pharyngitis, inflammations of the throat or pharynx, and this is actually present in both situations, pharyngitis. Okay. Next thing is the lymphadenopathy. Lymphadenopathy, that is present in infectious mononucleosis, and that is actually also present in the different bacterial and viral infection. But now, other thing is the splenomegaly. Splenomegaly, that is present in infectious mononucleosis, and in the viral and bacterial infection you can also see the splenomegaly. Okay, now the test is the monospore. Monospore is positive in this case and negative in this case. Okay, now I confirm, or I think that the chances of the infectious mononucleosis is more than the other bacterial diseases or infection. So, and that is the two most important thing. First one is the monospore test is positive, and that give the point to the infectious mononucleosis, and splenomegaly also give point to the infectious mononucleosis. But because in this infectious mononucleosis you mostly see the splenomegaly, so that's the two important things. If I still confuse whether it has infectious mononucleosis or not, another thing is you can go for the specific test of the infectious mononucleosis. So the specific test is the specific test. If I talk about the specific test, and that is the IgM and IgG. So actually, if I talk about the mononucleosis, so nucleosis. that is actually present in two situations. First is the early stage and second is the late stage. In the early stage, you will see the antibody, and that antibody is IgM. That is used for the diagnosis of the acute infection. So, IgM shows the acute infection. Okay. And late is the IgG. Okay. And that is for the diagnosis of the late stage of the mononucleosis. So now this is the specific test of the mononucleosis, and you can also go for the PCR. Okay. In the mononucleosis, you can also see other tests, or you can also see other things, like you can also see the lymphocytosis, other things in the mononucleosis. And in the mononucleosis, you can also see the atypical lymphocytes. Atypicals means large size nucleus and large amount of the cytoplasm as well. So this is basically the atypical lymphocyte. Actually, what happens in the mononucleosis, you will see the infected B lymphocytes. So actually there is a sequence. That is, mononucleosis is actually caused by the Epstein-Barr virus, and that Epstein-Barr virus infect sequentially. Like it will first infect the pharynx, that is the first part of the body through which the Epstein-Barr virus entered. So because as we know that the Epstein-Barr virus is transmitted through the saliva, so it first affects the pharynx, and after that it will goes to the blood, and in the blood it will affect the B lymphocytes, and due to the infected B lymphocyte, it causes the lymphadenopathy. So that's why it's actually the sequence: pharyngitis first, and second one is the cervical lymphadenopathy, and after that you will see the cytotoxic T cell destroy the Epstein-Barr virus infected B cells. So due to which you can also see the splenomegaly. So that's the clinical case of the mononucleosis. If you have any question, you may ask in the comment section. Thank you.